Hello everybody, and thank you for joining us for this webinar on the IMRF's Pandemic Response Project. My name is Teresa Crossley and I am the CEO of the International Maritime Rescue Federation. And this morning I'm joined by Dave Whidden, who is managing this project for us, and by Captain Udo Fox from DGZRS, the German Maritime Search and Rescue Service, and the immediate past chairman of the IMRF. Our aim this morning is to introduce you to this project and explain what we're planning to achieve, and also to give you a chance to ask questions and to tell us about your experiences of operating a SAR service in a pandemic situation. If you haven't already done so, please use the chat box to introduce yourself. The chat box is also the place to raise questions and to share your experiences. We'll be monitoring the chat box, so please make sure you use that facility, because we're going to be referring to the questions and experiences shared there later in this session. Finally, I would like to thank the Lloyd's Register Foundation for their support for this project, which we hope will result in something positive coming out of the current COVID-19 pandemic. The impacts of the current COVID-19 pandemic are still being felt around the world. Many aspects of life have had to change or adapt or stop altogether because of the new circumstances with which we are now living. But some things have not changed. All frontline emergency services, including maritime search and rescue, have had to go on responding to call-outs despite the risks posed by the virus. But they've had to adapt their ways of working to mitigate the risks from the virus to both the service providers and to those whom they help. Many of you will know that earlier this year, the IMRF set up a contact group to share information about the provision of maritime SAR services during the COVID-19 pandemic. IMRF members came together to help each other with such things as training, operational planning, and the sharing of best practice. It became apparent that there was no basic document that could advise SAR responders about the things they needed to take into account or the things they could do to ensure that they could continue to provide a safe SAR service. The result was the development of the IMRF COVID-19 operational guidelines for the provision of maritime SAR services. The idea of this document was that it would provide a framework for SAR organisations to use in their own planning, regardless of the size of the organisation or the level of resources available to it. It was available to IMRF members and non-members alike, and from the feedback we have received, we know that it's already been used in many places around the world. But the guidance is very COVID-19 specific, and we wanted something positive to come out of the current pandemic, which is where the current project comes in. I'm now going to hand you over to Dave Whidden, who is our project manager. Dave is a SAR trainer with many years of experience in SAR operations, both in the UK and internationally. Dave, the floor is yours.
Good morning, everybody, and welcome to the webinar. I hope you're all well wherever you find yourselves this morning. So I just wanted to give you a little bit of background in terms of what the purpose of the manual. I know Teresa has just introduced the project, but it's an opportunity really to capture all the lessons that we've learned from COVID-19 and how different organizations have responded, what sort of information they've put together. And the idea is that if a pandemic like this, God forbid, happens again in the future, is that organizations don't have to start from scratch again, and there is a one point of reference that they can look at in terms of getting that information that they might need. Also, what good practice is available in order to assist organizations to maintain their safety. And as I say, should a future pandemic occur, it's a resource that can be used to sort of use as a reference of what was done throughout the COVID-19 pandemic. It also allows that resource then to help organizations handle some of the challenges that could be posed. And it will contain lots of useful information that will have diagrams, infographics in an easy to understand format. It will be available to IMRF members and maritime search and rescue organizations from around the world. And as I said before, it will be used where there is minimal guidance, procedures, and information available. It will also be in an easy to understand format for countries where English may not be their first language. Because from my experience, when we work overseas, where we have manuals that are in English with lots of writing, with very little infographics and such, it's really helpful for individuals to be able to really see clear steps to take, and also images that back up what we're trying to do. So the manual will very much have all that, as I said, in a very easy way to understand, so that non-English speakers in specific can really make the best of that information. It will, in terms of how we're going to distribute the manual, it will be available as open source, and it will be free to download from the IMRF website. And it can be used for training and planning. And again, what I found from experience is that it's really useful as a training aid. If you're going to do top table exercises, you can use the manual as a guidance to help you with the planning as appropriate. And we're planning on launching this resource in early 2021. So at the moment, we have an early draft, which has now been composed, and the idea is now that is going to be peer reviewed by a number of IMRF members from around the globe, which is an opportunity for them to be able to give feedback and also to comment, so that we make sure that it's reaching the right audience. And just to give you a little bit of a flavor of what's in the manual itself. So we've broken it down into various units. So unit 1 is to give people a background to what a global pandemic is, because again, I was aware that pandemics existed, but I've never experienced one before till COVID. So it just gives you a bit of a background to what pandemics have happened in the past. And then a little bit of how pandemics are in terms of the containment and mitigation steps that are done. And then also who the different stakeholders are around the globe. So obviously we've got stakeholders like the World Health Organization, who have a key role in tackling pandemics and providing guidance and information. And then looking at the national governments and also local guidance that might come out through the different steps as the organizations start to have to collate the information. It will also look at now the specific of what some of the priorities for search and rescue organizations might be, obviously in terms of maintaining the core service of a maritime search and rescue response. Also non-prioritization of activities, so some activities that might not be priority, what some of the considerations we can do. Also training seems to be a big one in terms of how do we maintain training throughout a pandemic, and how do we prioritize those aspects of training in order to maintain the service, what are priority training events and what are non-priority. Also, one of the things that has really come out throughout the pandemic is also the importance of well-being, both for personnel, staff, volunteers, depending on what organization you're from, is how we maintain that well-being throughout the pandemic to make sure we're keeping our staff safe and also well-informed, and obviously check on their well-being throughout the whole time whilst we're maybe facing restrictions due to the pandemic. Also, environmental considerations, you might be aware as you walk around the street now, or if you go out on a service, we're finding that there's a lot of environmental issues that are coming off the pandemic, in terms of seeing a lot more masks being disposed of inappropriately. So again, looking at how we can safeguard the environment, and then medical considerations as well, as we respond to different challenges in terms of how the virus might spread. It's making sure that we are keeping our personnel safe and considering all the aspects that we might not have had to do before, like wearing masks and so forth, defending. So as I say, it breaks down into all those different aspects throughout the manual that sort of give organizations guidance and easy to follow sort of step-by-step things that they might need to consider. And obviously every organization is going to do slightly different depending on their guidance from their government, but it's just an easy reference that they can refer to, as opposed to having to go back to square one and start the whole process from scratch. So as I said, it will be it's in draft now, and it will be going out for peer review, where we've got members from around the whole globe, so that we make sure that it's reaching the right audiences in the right format, and especially for countries where English might not be the first language, to make sure that it is in a user-friendly format for accessible to everybody. So that, in a nutshell, is how the manual will start to take shape, and yeah, we hopefully will have it ready by early 2021 to be launched. So I'd like to hand you over now to Udo, who's going to give you a little bit of a background in terms of how DGZRS have been responding. So I'll hand the floor over to Udo, and I look forward to receiving your questions later on in the webinar. Thank you.
Yes, good morning, everybody from Germany. So I was asked to talk a little bit about how we handled the situation, and when I thought about it and I took some notes, I came to the conclusion that probably we have simply done what other organizations also have done, more or less, depending on their capacities. So when I thought about the key challenges for day-to-day, so the biggest problem, of course, was for everybody this high uncertainty right in the beginning. So we all realized something big is coming, very huge, is coming up to us, but how can we deal with it, and what are the consequences? So then the question is how to respond adequately to such a situation you have never faced before. You start thinking about what can happen, what might be the problem we will face, what is the most likely scenario, what is the worst scenario. The focus, of course, was, our first priority was health of the staff. And secondly, the question was, what are the things which need to run under all circumstances, like, for example, the Rescue Coordination Center. The problem, in my view, is we try to manage an organization by only looking backwards, because what we see now, the today's figure of the person who are infected is actually a matter which has happened 1 week or maybe a little bit longer back. So maybe at this stage we have a decline in the infection rate, or maybe we have a high increase in the infection rate. So there's quite a lot of uncertainty. And that means it's somehow a stochastic approach to plan ahead. And that's not really easy. And there is always a risk to take the wrong decisions, but there must be decisions taken. That is no question. So how did we adapt to the situation? We decided very early, much earlier than other organizations or companies in Germany, to have a shutdown at the headquarters. And we focused purely on core activities. So there was no public anymore in the offices, or we did not have sponsors coming in. We reduced staff. We implemented home office wherever possible. We tried to group, if possible, staff into cohorts. So in in groups staying together while they work so that they don't mix up all the time. If possible, we reduce stuff in our shipyard or partly also on the rescue boat stations so that we could not fulfill all functions, but at least the core functions of search and rescue. And we started to isolate personnel belonging to COVID-19 risk group due to medical condition. We also tried very intensively to keep the supply chain for medical equipment like masks or disinfectants functional, which was not easy, but thanks to the lasting cooperation with our very helpful suppliers, we managed better than others, I think. Key learnings. I believe it's very easy to say what we have learned, but it's not easy to bring it into practice. So first thing is plan to stay ahead of the situation, but don't stick to the plan because you need to change it permanently. It's a matter of dynamic risk assessment. And this means it needs a high degree of flexibility by all members or all staff. And last but not least, and this is also not very new, communication is very important. Inside your own organization, but also outside with your stakeholders and shareholders. But unfortunately, as we have our webinar, yes, it works, but it's not as good as coming together live. Communication becomes more difficult. That's so far my statement for the discussion. Thank you.
So what we would like to do now is we've had a few comments come through already. We've got a comment from Mohamed Strissi from Morocco, who's talking about some of the adaptations that they've had to do in Morocco in order to maintain that search and rescue. We also have a comment from Mike Roberts in terms of how they're taking, I believe, that ATC air traffic control solutions. So what we would like to do is if participants that are have had to do some adaptations, if you're able to share some of the experiences that you've had, specifically in some of what your day-to-day challenges have been and how you've had to adapt. Also, what your key learnings have been from the whole pandemic so far. And also, if you've had opportunity to use the IMRF COVID-19 guidance that was published back in April this year. So, as I say, this is an opportunity for all participants on the webinar to please add. So, what I'll do is, as people add them, then I can start sort of reading out and looking at what is coming up. So Mohammed here is saying that they've created a local community to deal with the case and evaluate the medical risk when performing SAR operations. And many agencies involve special COVID-19 medical teams to join the crew on board. So that's quite an interesting one, that actually one of the solutions in Morocco is that they're actually looking at taking specialist medical personnel on board with the crew. So that's again a consideration of how do you work with other agencies that that you have to change how you're responding. So if you're allowing medical specialist teams onto your boat, there's obviously lots of considerations that you have to take on board there. So that's a good. So, and Mike has just got back to us in terms of the cloud-based solutions. So that's how technology is really helping out with coming up with some solutions. So what was interesting for me is when I've been doing some research in order to looking at the pandemic, background to the pandemics, especially recent ones like this big Spanish influenza pandemic of the sort of 1918s, 1919s. The things that they had to do were very, very similar to what we've had done in terms of the containment, the mitigation, and also getting the people to comply with the advice in terms of wearing masks, social distancing. But in those days, I guess they didn't have the technology that we have, but yet they were still able to adapt to the day-to-day response that they were having to provide, especially sort of military organizations and frontline organizations that were dealing with that pandemic. So as I say, if anybody's got any other things that they'd like to share with us, and as I say, if you look at the slide, the things that we're particularly looking for is what's been your sort of biggest day-to-day challenges. I know Udo has mentioned some of the ones from DG ZRS, and also any adaptations that you've done, any of the key learnings and use of the COVID-19 guidance. So I'll give you a couple of minutes, and if Teresa, if you've got anything to add at this point as well.
Yes, I was just really, it was a question for Udo as well, bearing in mind what Mohammed has said about working with outside organisations. I mean, did DGZRS have to adapt its plan, or did it do some joint planning with some of the other organisations that you would have to work with? And did you also consider taking specialised medical team with you on, planning to have specialised medical teams involved in joining the SAR crews, or how did it actually work, that interface with other organisations?
Actually, we did not really change dramatically the system, because we are prepared for infectious disease in practice. We do some few hundred medical transports, especially from the islands. So sometimes we face meningitis, or you have to expect, for example, if you have a medevac from a cargo ship, it might be a person which has a broken leg, but unfortunately also tuberculosis. So we train our staff, we have guidelines, we have the equipment on board. In some cases, on a regular basis, we cooperate with ambulance services, for example, or fire brigades. And during standard operation, normally we stay by ourselves.
That's quite an interesting aspect of what I believe in terms of the preparedness to these situations. I think sometimes we omit to actually to prepare adequately, and although this pandemic, I think, caught a lot of people out, sort of in terms of not having faced a situation like this before, I think that's where the tabletop exercises really come into play, and having that plan. And as Udo said, be prepared to adapt your plan, because obviously as things progress with the plan, there's a saying coming from military background, is that no plan survives first contact with the enemy. But at least if you've got a plan and you've got some guidance and you've got some sort of key lessons that you've been able to sort of review and have some things in place, you won't be so caught off guard. And hopefully this resource will be, if God forbid we ever have a pandemic of this magnitude in the future, is that it is there to sort of use as a reference to allow you to start thinking about what plans and what adaptations you might need to put into place, as opposed to, as I said before, trying to sort of go from no information at all. And that's where the IMRF was really, really good in getting all the members very quickly together to sort of start looking at what all the different members were doing. And what we found is that a lot of the members were actually doing very, very, very similar things. So it was a really good lesson sharing opportunity to sort of collate that information to make sure that we are learning from each other, which is again a really valuable way of working and bringing in different organizations, key lessons and how they're doing things. And that way you can go with a bit more confidence that if you're doing similar things and everybody's sharing that information, it really makes life a lot easier. So we've just got a Malaysia Coast Guard, Susanna has just mentioned it was totally a new process where we, and again, going back to my point of a new process and where we need to evaluate each and every request for medical evacuation and also in saving lives, especially migrants. So yeah, that whole aspect as well is how do you start to deal with the medical considerations which you haven't had to think about thus far. Again, amending search and rescue SOPs, adding the requirements for wearing PPE. Yeah, and again, the manual really sort of looks at in terms of how to adapt your SOPs accordingly, the PPE. And yeah, it was a very hectic time in the early days of the pandemic. And I think for every organization that has been involved, it's that initial newness of the situation and having to very quickly change protocols, review SOPs, create new risk assessments. But what's interesting is that, again, taking medical teams on board the ships in order to carry out that medevac. So that's something that, from what we've seen, is a number of organisations have taken on that route. And also making sure that you're working closely with other departments such as marine departments, national security councils, Ministry of Foreign Affairs. And again, that's the whole stakeholder management, isn't it? It's to making sure that all the relevant stakeholders are kept informed, and also working together to make sure that there's a joint approach to dealing with the ongoing situations. So thank you for your input there, Susanna.
And I think that Susanna's comments there about, it was totally a new process, and picking up on that, that's really what we hope will come out of this pandemic manual. It's not going to apply to everybody, but hopefully it will provide people with some thinking that's already been done, or at least to point people in the right direction, so that when you are faced, if you are faced with a new situation, you have at least got somewhere to look to provide, a framework for your thinking and planning that you can adapt to fit whatever circumstances you have.
Yeah, and we've just had Candice comment, is one of the challenges which was faced was the sourcing and distribution of PPE. And I can remember in the early days that was a real issue in terms of the daily news that we were getting was how lack of PPE was presenting a huge challenge for both national health services and also other organizations that now suddenly need this PPE in order to be able to provide the service. So again, that whole contingency planning, thinking about, well, how do we keep supply chains open throughout this whole process? And again, all this is captured in the manual to have sort of those contingency plans in place to allow you to maintain that vital service, making sure that there is a contingency plan in place. So I'm just carrying on reading the comments going through. So we've got one again from Mohamed Drissi from Morocco in terms of, so again, going back to multi-agency, so making sure that all agencies that are going to be at the forefront are working together in order to ensure that all the information that is needed is shared and have the right contingencies in place. And Mike Roberts is sharing here some information on the a cloud-based search and rescue, which is can be run from home. So that'd be really useful, as he's sharing his contact on LinkedIn. So if anybody wants to look at that, Mike Roberts has offered to share further information on that. And again, we've got Anwari Nabil undoubtedly putting under the scrutiny of the assessment the medical status of potential survivors. And again, that it presents a whole new ball game where you have to think about how you're going to deal with the person you rescues, who could be potentially highly contagious. So it's having those plans in place to be able to maybe take them into a room where they can be isolated and then handed over in a safe manner to down the other emergency services or medical teams that might be coming, and without taking them into spaces where they might be putting other people at risk. So it's having that clear sort of evacuation plan in terms of where you might be putting people that present with any symptoms.
And I think it's also an interesting point about the time range of interventions might be affected, because obviously if you're putting in extra steps into your process, the actual, not just the planning of the operation, but the timing of operations and the that also sort of gets there's a knock-on impact on that potentially from some of these adaptations.
We've just got another comment here as well, is also being able to have quarantine and swab testings for all crew before embarking, dividing if you're working on a big vessel, then also having different areas of the vessel where you can potentially create those social bubbles of people in small groups, and they're not mixing with other parts of the ship. So that's a really good point in terms of if you've got a big ship with lots of crew, is how do you manage the social distancing aspect and keeping people in minimum contact with others. Also having decontamination areas before going inside the ship. So yeah, lots of things to think about, and it seems to be an ongoing adaptation as a situation rises.
And then I think we've got somewhere a comment from Uruguay, from Hugo, about well, her experience of very early on in the pandemic getting involved with the evacuation of passengers on board a cruise ship. So it's a sort of a mass rescue operation of a sort, with you know, not knowing presumably how many passengers were infected or potentially infected. You know, so quite a large operation. And Hugo also says that collaboration between all the agencies involved is paramount, which I think gets back to what you were saying, Dave, about the usefulness of at least tabletop exercises, even if not live exercises, in sort of rehearsing different scenarios so that you feel a bit more confident about what you might face.
Yeah. And again, I think Ugo's picking up on that point again in terms of it's not just one agency, it's multi-agency. And again, it's making sure that all the agencies have worked together prior to the emergency situations. And yeah, so that's coming out quite strong within everybody's challenges to making sure that everybody is planning and prepared to deal with these situations.
And I've just seen something from Theo van der Linden in the Netherlands, who's raised the point about travelling to and from the lifeboat stations for operational crew. And I know that was something that came up in the discussions that we had within our working group about the difficulties that, you know, where there's a lockdown situation, or where, you know, there are national restrictions in place, or even local restrictions. One of the things that you need to think about is how you will actually get your crew from wherever they are, particularly if they're volunteers, from, you know, where they are at the point where the call out is made to the lifeboat station or to this operations centre. And as Theo said, the Netherlands asked for a voucher for free travel, and I think that happened in France, or it was one of the things that was under discussion in France as well, because otherwise people couldn't physically, you know, they weren't physically permitted to move to be able to be engaged in a response or in a call out. So that's a very relevant point.
And again, Richard has just made a point here around using technology. So the Italian Coast Guard is using an app, which is kind of an early warning system. And again, it's looking at how the technology can really help us, especially when it comes to sharing information and collating information as well. So technology is making a huge difference in terms of how we can potentially respond to situations. But my advice with technology is always have a backup plan, because technology is great whilst it works, but it's the moment that we've become so reliant on it and it stops working, and then we have to go back to pen and paper and different means of communication. So yes, I am a great believer in the use of technology, but I'm also a great believer in having a contingency plan for when comms break down and when the technology that you're so reliant on stops working. So don't forget, going back to basics sometimes has to be put in place. And again, it goes back to my point of being able to adapt to your plan. And I think Udo highlighted that as well, is the importance of being able to adapt, but also making sure that you are keeping people safe whilst doing so.
I think there's also an interesting contribution from Anastasios in Cyprus, which is kind of, well, it's a bit like the principle that the ship is its own best lifeboat sort of thing, because he's saying that one of the things they they did there was to make sure, you know, if the ship or if the vessel was in range of a port, reasonably safe range, then to get the ship to use its own transport to get the patient, to get any patients in terms of medevac on, to try and minimise contact with sort of third parties, if you like, which I think is, you know, quite sensible.
And that's, again, if you look at the early days of when a lot of the cruise ships had to be brought into port, they pretty much quarantined everybody on the cruise ships. So yeah, that makes perfect sense to keep everybody contained in that one area, and before you start considering mass evacuations and potentially making the situation a lot worse, is what other options are available to you. So it's also thinking what other options before particularly going round that one. And say if you prepare for this and do the planning and the tabletop exercise and the live response, it allows people to start looking at other options, because sometimes when we get the call, we are very sort of focused on the rescue, and yeah, so it's sort of taking that step back and sort of taking that over bird's eye view of everything that's going on. And that's where obviously your command and control comes into place. But it's important, as I say, that we're well rehearsed in all those processes.
And I think about the sort of ongoing risk assessment, the sort of dynamic risk assessment that Udo mentioned. Anna from Uruguay has just said in Uruguay they found that the provision of PPE for the actual people rescuers or the responders was the most important thing, and that you'd think twice about it. But I guess what that's really saying is you have to take a judgment about the risk assessment for the safety of your service provider, you know, for the responders, because they need to be safe above all before you then think about the rescue. So there's a kind of pre-risk assessment to be done before you even get any further, you know, whether you've got appropriate PPE, whether you've got the right equipment, the right expertise available, maybe. But you know, I think she's just reinforcing the point about this dynamic risk assessment.
We've got a couple of more comments come through in terms of how Liberia has been able to adapt through making adjustments to watchkeeping patterns, and then also to dividing the team up to 3 watchkeepers, allowing sufficient rest time, and also training with other organizations. So National Public Health Institute training, so that crews are better prepared to deal with the medical evacuation. So again, it goes back to what we've been talking through. And then we've got another one come through from Cote d'Ivoire, which is great to see that they've been able to maintain a very effective service between March and August so far, where they had 5 medical evacuations. And again, it goes back to that whole multi-agency approach. So you've got your port authorities, all the different companies, even the private sector as well, how the private sector can be used. So yeah, great to see how different organizations are adapting and working together to overcome the challenges.
And I see somebody, Angelo Abreu in Madeira, has said that they also had they've set up a system of passes in collaboration with the police force that allowed people who needed to get to rescue centres or for lifeboats to be able to travel as long as they had the correct ID from the institution. So again, I think that's something that is definitely something that you wouldn't normally have to think about, but in this situation is definitely something that needs to be considered. I see Anna Caterina Quiroga, who actually is the coordinator of the drowning resuscitation guidance that we also participated in with ILF and the Institute of Drowning Research Assistance. She's asking if anybody has information regarding infection rates of professionals, or if anyone was infected during a rescue operation. So if anybody has got any information on that, then please feel free to either put it in the chat box, or if you'd rather send it separately, if you send it to info@imrf.org.uk, we will make sure that it gets to Anna Caterina.
Okay, Udo, did you want to add anything at this stage, Udo?
Yeah, if you allow me.
Sure.
I just want to add, so every time you go out for a rescue operation, you have to consider if the person you save is infectious or not. Independent if we talk about corona or, as I said before, a broken leg. So as soon as somebody shows symptoms of an infectious illness, you have to take some measures. The first measure is always, okay, separate the crew as good as possible from the patient. The second thing is give the person which is infected, give the person a mask so that the person will not spread the virus in the ship. And of course, the crew has to wear PPE, no question about that. But this is a standard procedure, which is not only related to COVID, it's always the same measure you take. You analyze the situation. I have a person on board which might be a risk for my staff. So then I have to take measures, independent from the actual situation, I think. Thank you.
Yes, it's obviously highlights the importance of having the right PPE when you are doing any medical intervention, and that's standard within most organizations. But what I've found is obviously things that we wouldn't have maybe be so rigorous in the past has now suddenly highlighted the need to that extra consideration for the sort of whole cleaning and hygiene process of after you've evacuated, and being a bit more mindful, I think. So it really homes in the importance of, because I know in the past people can be not blasé about PPE, but don't really take serious the importance of wearing it. And it's just a really timely reminder of the importance of making sure that we are looking after ourselves as professional responders in terms of your own personal safety and being strict with your hygiene protocols and your PPE. And again, that I think COVID has really brought that to the forefront of how we make sure that we are protecting ourselves. Do we want to go to the next slide and look at maybe taking up some questions, or have we got a few more comments that have come through? Yep. So
a couple of people have just come back quickly on with some information for Anna Katarina about the number of infections. So KNRM in the Netherlands has had no infections, for example, during SAR missions. But then we had an infection, he says, when 2 crew went in 1 car to a training centre. So I think, again, that's another aspect. It's of getting your crew to the point, you know, that you need them at safely. It's not just about the operation itself. It's about all those things that that surround it. But yes, let's. Shall we move now to see if we've questions and answers from anyone? We got any particular questions? If anybody raises a question, I should just explain at this point that everything that's been put in the chat box has been recorded, and any points or any learnings from there, or any questions that we don't get a chance to answer today, perhaps, will all be collated and placed on our website with the recording of this webinar, so they won't be lost. And if anybody has anything or any questions that they want to say or that they want to contribute, or any thoughts that they have after this webinar finishes, or any questions after the webinar, any comments, then please do contact us at IMRF at info@imrf.org.uk. The address is on the slide, although unfortunately Dave is currently hiding it, but there we go, that's it. So if anybody's got any comments or anything they want to share after this, please do. But if you've got anything that you want to say or do now, just before we close the webinar, then this is your opportunity to do so. Okay, I think Mohammed has just made a further comment about the Moroccan SAR services establishing a special lockdown for the MRCC with 5 days duty instead of 24 hours to sort of minimise the number of times that the teams have to train, which again is goes back to what we were saying about it's not just the actual operation itself, it's all the things that support operations, including training, including shift patterns, including the provision of PPE, all those things which you have to think about. I think at 12:17, I think at this point I'm going to draw the webinar to a close. As I say, anything that is captured on the chat box will be recorded, so none of it will be lost, even if it hasn't been read out or mentioned during the session. I think it just remains for me to thank you all for attending, and to say that we just have a quick poll just to say whether you found it useful or not. And if just before you sign off, you wouldn't mind just filling in the vote. It's just a very quick pulse survey, really, just to see whether it's been useful or not. Please just click on it and tell us whether you found it helpful. And we will keep watching our website, because the pandemic manual, as Dave has said, will be published in January, hopefully. There'll be more information about it then. If you've got anything that you think we need to think about in the preparation of that manual, please do get in touch. Otherwise, I'd like to very much thank Dave Widden, who has sort of facilitated this discussion, and as I say, is the project manager for the project, and also Udo for his insights from his experience with DG ZRS. So thank you all for joining us this morning. Please stay safe and do keep in touch. We'd love to hear from you. Thank you very much indeed, and see you again soon.